Certainly with anybody who's considering a tracheostomy or where a tracheostomy is being considered, there are certainly a number of steps and different teams and people that are brought in to be involved, either from an educational standpoint, sort of beforehand, to help them understand sort of what a tracheostomy is. Is it a tracheostomy with mechanical ventilation or just a tracheostomy, which are two whole another thing, and something that really needs to be explored. The surgery itself and sort of what to anticipate from the surgery and anesthesia, and then certainly the immediate postoperative course, as well as the more long-term care. Who are going to be the teams that are following along? Is that a pulmonologist? Is that an ear, nose, and throat doctor? Who is the one who's helping to be your go-to, to be the team as a resource for the family? Fortunately, now they're pretty portable. The few different machines that are used to help provide that ventilation sort of support, whether through a mask or through a tracheostomy. They're fortunately fairly portable now, but you still have to think about then sort of battery life if you're going around and being portable, having those other tools available, suctioning and everything else that comes along with it. So yes, there are things that are portable, but there's a reason why there are so many people and machines and things in intensive care units, because often it requires a lot of attention to take care of a child who is needing this degree of support. I think having a tracheostomy with or without mechanical ventilation, certainly mechanical ventilation adds a whole nother layer to it, but certainly requires a lot of attention. And when those decisions are coming up, we often work really closely with our case managers to try to best understand what are those community resources. Is there private duty nursing? Who within the family is going to be trained to understand how to manage this? Which teams are going to be involved to be your resource, your go-to resource? Is home the right first step, or is going to a rehabilitation facility where you can work more on practicing those skills and management, so that families feel more comfortable with providing all of that care? There's a lot of decisions that go into it. I think we often, as a tertiary or quaternary care center, see patients and families coming from all over the place where those resources, unfortunately, just are not available. And so then it makes it a complicated decision even more complicated of is uprooting the family and moving to a more resource area. Is that really something that they want to consider? What's the anticipated risks and benefits of tracheostomy, not only clinically for that individual child, but within the context of the family, within the context of how is this going to both hopefully, if the decision is made, hopefully in a good way, allow for them to be home, allow for them to improve their quality of life so that they're not stuck in the hospital. But many loving families decide, for many different reasons, often pulling all of those pieces of information together, the clinical information of their child as well as their family, that moving forward with something like that is not what is in their child's best interest.